Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Shiv Goel, internal medicine and functional medicine physician. Today's Kevin MD article is Normal Labs Miss What Most Patients Are Living Through. Shiv, welcome back to the show.
Thank you for having me, Kevin.
All right. So, why did you decide to write this particular article on Kevin MD?
I think this is what I see every single day in my clinic. And a lot of people are coming and they have been to multiple physicians. They have done everything right as per the evidence shows, and they still don't feel that they're healthy. They
Mm.
still don't feel that their life is what we call is they feel that vitality in their life. So, for example, patients who are having difficulty in sleeping, they are having such a stressful life. They don't know the real reasons because their blood pressure is okay now, their cholesterol looks fine on paper. And so when they go to their doctors and they just don't feel that they always feel that something is missing in their life, but they don't know whom to go to. And that's when I decided to look deeper into it, and that's what this article is about.
Okay. Now, for those you order blood tests and everything's okay, blood pressure, cholesterol, and they're still clearly feeling unwell, just based on your experience and what you discuss in the exam room, like what are some of the reasons why that could be the case?
I think the most of the time the reasons is their lifestyle.
Hmm.
The reason is the people around them, the relationship, their personal, their professional, their work issues. And it is something like people don't relate it to the health. They just feel that they are separate things, where the personal issues, they just keep happening in life. The work is work, and health is something until unless they get sick, then they go to the doctor. So everything is so fractured and divided. Nobody is able to relate that everything is related. You know, if they've been having a stressful life, they gaining weight, they having issues, whether it's with their personal at home or at the work, or because if we have stress, we tend to get our brain try to compensate it with what it can to prevent it from going into a crisis state, which results in our adrenal fatigue. I know that a lot of physicians they don't agree with the concept of chronic adrenal fatigue or adrenal failure until unless somebody develop a adrenal disease or an ICU in the
Hmm.
shock. But I have seen this, a and when they come to me, I see their patterns, like what's going on in their life, how the situations or surroundings are. And I do not usually ask them directly, but it's an indirect kind of a to know how they are, how their environment is at home, at the workplace, and how are they sleeping good? What do they feel first thing in the morning when they get up? Do they feel very refreshed, or they just don't want to get up from the bed? Okay, there are few clues which we can get it and take it from there. And there are scientific evidences now which shows that how stress itself, our gut-brain axis, our HPA axis, how it is linked to autoimmune issues, decreased immunity, it linked to hormonal imbalance, in fact, dysbiosis of the gut. It's just like one after another to even the neurotransmitters, even the neurosis. So much links is all there. So it's all linked together. But if we don't look deeper, we're never going to know.
Now, what are some of the ways that you can look deeper? Is it simply asking patients in the exam room? Do you order specific tests? Because in your article, you use the term sustained threat physiology. What are some ways that you could determine whether some of this sustained stress is causing physiological damage?
Okay, one is that we can order a Dutch test. I use it to see the salivary cortisol levels 4 times a day to see what is their level, what is the curve. The people, those who have either a sustained sympathetic stimulation for a long period of a time, you will see they will have a flat curve. Okay,
Okay.
and we can also do the organic acids test. We can also do their sleep pattern, heart rate variability. Nowadays, everybody is wearing the watch with they have iPhone, iWatch, so they can see it's easier to check that. And I usually also check all their hormones levels, especially the salivary hormones level, and because their numbers vary throughout the day as well. and blood is not very consistent way to check because the hormones carry in the blood, they don't act in the blood, and they act at the tissue level. So salivary hormones are very accurate, or you can do the urine one, and that gives me an overall idea. I can also check their neurotransmitter in the saliva level, so to understand what is going on there, and then relate to their symptoms, what they've been feeling, what situation they are in, and then you're going to come to know that it's just mapping out.
And just to be clear, like you said, there are a lot of people who don't order these tests. And to my knowledge, there's not a lot of evidence that support the ordering these tests. But from your experience, you can have some actionable treatment plans based on what you find
Yes.
from these endocrinology tests, right?
Yes. And a few of the things which I recommend is that, and I know that I not all of my treatment plans are so-called evidence based, because evidence is also based upon different demographics, different, especially the level of the hormones level, they vary significantly from, such as testosterone, just take it from 280 to 900 or 1000. That's a whole normal range. So what is your normal range? That depending upon your lifestyle, that depending upon your age. There's so many other factors which can contribute to that. So when I see something abnormal in the test, I just don't act on a number. It is not a number that, okay, somebody has it. What's going in the person? If the patient is a sick, sedentary person who doesn't do, that person gonna have a flat cortisol curve. Okay. But if a person who is feeling exhausted, who doesn't want to get up in the morning, who feels like this is a chronic fatigue, I feel like I can't function, I'm feeling like a burnout, and then you have a picture, so then it is very clear that it is consistent. Then we check their DHEA level, their vitamin D level. So everything, it's a whole picture. It's not just one thing. And when we start them on a protocol or a treatment, sometimes I give them a very small dose of a steroid if they are really fatigued. They cannot just to get it over because they do not have, like I had a patient whose morning cortisol level was less than 2. Less than 2 was a morning cortisol level, and the evening cortisol level was 0.5. It was already crashing. But he doesn't meet the criteria of Addison's disease. That doesn't mean the person is not sick. The person is severely sick. He has no drive left in his body. He feels like he has to drink 5 Red Bulls and coffee to just get up from the bed. So because he has been running on like this for years and years, there's nothing left on it. So you have to give them the break. You have to, counsel them regarding taking a break, meditation, mindfulness, breathing techniques to help increasing the parasympathetic drive and decreasing the sympathetic drive. And then for that, we still have the evidence. We can show that how that helps in decreasing your stress level on the adrenal gland health and overall impact on that.
Now, tell me what you would say to the critics, and I know functional medicine has a lot of critics who say
Yes.
that ordering a lot of these tests, like you said, isn't supported by the evidence, and a lot of the treatments and the tests for that matter, they're not covered by insurance, so there's a lot of out-of-pocket costs for patients. So what do you say to these critics who just use that line of argument against these tests and functional medicine in general?
Okay, so I would say that why do you guys keep testing your apolipoprotein B, A, and everything when you know that it is what it is, So I don't order tests just to show that I'm collecting the numbers. I order only those tests in which it makes sense, such as if somebody is giving me or telling me that he doesn't feel like he want to get up from the bed. Okay, he doesn't have a good sleep. It's been years he has slept well. Okay, so in order for me to confirm it, then I order their salivary cortisol pattern, the Dutch test. Okay, so that doesn't mean I'm not ordering all other bunch of millions of tests for them, and that is for me to understand if it is correlating, and 99% of the time they correlate. So that means there is something behind it. I don't order millions of tests. Yes, if somebody has an autoimmune issue, there's a one female who has been diagnosed with so many different autoimmune issues by 3 different endocrinologists and rheumatologists, and all 3 of them have different diagnoses.
Mm.
Okay, so when she came to me, I found out that the year all of the autoimmune issues started, her mother passed away. Then a few months later, her brother passed away, and then she underwent a surgery. So she was going through an extreme stressful situations, which lasted for a year. And about 6 months later, she had a first flare of skin rashes, and they diagnosed with her autoimmune issues. And then she started having the nerve pain, and then they said inflammatory neuropathy of unknown origin. Okay. So what I mean to say is that everything is related. It is instead of like I studied internal medicine, I was an anesthetist before that. Okay. So from anesthesiology to internal medicine to functional medicine, I know the science and I understand what evidence is. Okay. But evidence keeps changing.
Hmm.
Evidence means that we only know this much right now. We don't know. Tomorrow something comes up, we keep back, oh, we were not right. Like, let's have this one. Okay. So having this, what's wrong in that? Okay. I don't know yet, but there is something more than what we know. I think that's where we have to start instead of making that this is what all it is.
Now, I'm going to assume in your practice that you spend more than 15 to 20 minutes with
Yes,
your patients, so you're
yes,
able to suss out a lot of the underlying reasons why patients are feeling why they do.
yes.
So, what kind of advice do you have for busy primary care clinicians who see patients every 15 to 20 minutes? Tell us the type of questions we may need to be asking more often, and maybe just some other tests that aren't necessarily in our evidence-based panels that we may want to consider.
Yeah. So I understand that 15 to 20 minutes is not an enough time, but I think a lot of primary care physicians, they are been seeing the same patients over a long period of a time. You know, it's not that in the first visit. They can create, like I have created a protocol, a map in which the patient, before they even come in, fill all the information. What is their sleep pattern look like? How do they feel in the morning? So when you have all of these things before in your hand, okay, you know what's going on with the patient. Okay. Hardly, I think, if I have all the right data in front of me and the patient is being honest, I don't think it's 80% of the chances my diagnosis and my input doesn't change. Okay, then it is all about confirming from the patient. And sometimes patients say on the second, third, fourth, or sixth visit something which makes me go back. Okay, but a lot of time it doesn't happen. So that is the one thing. Second thing, we are in a time of AI. So by using integrations of the AI, they can synthesize that data without giving the patient's name or that information, and you can create a lot of things beforehand. Okay. Second things, I think it's a time when people, those who really want to dig deep into their health, there's a direct primary care. You can offer them the other models. So you also shouldn't have to suffer just because you're spending too much time. So you can have an extra revenue too. You can start a membership for the patient, those who want dig deep into their root cause analysis or to find out why they're having, because insurance company are not there to keep them healthy. They are there when they become diseased so that we can write a prescription for them. And I understand their perspective as well. So, but I think this is somewhere where medicine should be heading towards, not just putting a prescription or a band-aid on somebody and it keep doing the same thing, because finally we feel burnout. We feel like we are not doing anything we were supposed to. It is both professional and personal.
Now, one of the reasons sometimes why we are cautioned about ordering too many tests is that it could uncover symptoms that may necessitate more testing for symptoms that are eventually pretty benign. Now, do you ever encounter that whenever you order these cortisone levels or these other tests to the patients, and that
I
necessitates a treadmill of more tests for things that are eventually benign?
No, so I only order test. First of all, I try to order test which I think gonna benefit or add into the diagnosis.
Hmm.
If it is not gonna add into what I'm thinking, I do not have to order it. Okay. There are certain kind of a patient. It's a two-way street. I have seen there are patients those who just want $1 million workup to be done. They have the money, and if I don't do it, they go to the some other. So I just send them to a lab. They can get the whole panel done, all the allergy testing, all the genetic testing. They just want to make sure that they don't never gonna have a cancer or whatever. But If personally, I only order the test if somebody is telling me that this is what the symptom they're having. A lot of times it happens to me that I discovered something, which is sometimes, not a lot of time, which patient was not telling me. So in fact, it gave me a tool in my hand for the patients to let know, you have to be honest with me. If your test is showing your testosterone level is 1000 and you are 50-year-old, okay, and you're saying that you never take any testosterone in your life and your LHFSH is low, okay, that tell me you are not telling me the truth. And if you don't tell me the truth, I can't help you. If their PSA is going up high and high, I do not order PSA on anybody over the age of 65, 70. Okay, I don't have to, because what am I going to do if the PSA is high? Okay, at that age. So those are the things I always keep in mind. I do not have to order the test just for because I have to prove myself to be I'm a functional. So just order all the kind of a unnecessary testing. No, you do not. You only order tests just to correlate that what the patient is saying and what the science says, they actually goes line by line. Okay, I'm not disregarding the evidence based, I'm not disregarding the functional based either. I am trying to build a structure which help the people and from their root cause, give them the insight into the structure, why is it happening to their life, okay, what they can do, and how can we help them.
We're talking to Shiv Goel, internal medicine and functional medicine physician. Today's Kevin MD article is Normal Labs Miss What Most Patients Are Living Through. Shiv, let's end with some of your take-home messages that you want to leave with the Kevin MD audience.
I would say that to every physicians out there, first is listen to your patients. If your time is doesn't allow, then come up with an alternate practices such as direct primary care or membership options. But there are a lot of people, those who can afford it, and they need help. A lot of patients, those who can't afford it, I still help them. I still go above and beyond to ascertain them that this is what it is. Because ultimately, healing is their job. We can only show them the light. We cannot take them on the path. So spend some time. If you can't create a structure, create now we're in the age of AI, create an intake forms which comprises everything and get it through the through a structure so that you don't have to spend much time and you'll be able to provide better care to your patients. And I think I also keep learning every single day, and that is the good thing for me, that it keeps me not on my toes, it keeps life interesting, that every patient comes up with something which I never thought of before. Okay. And I think that is what we are here for, to be the healer, not just to be the physicians or providers or whatever. This is.
Thank you so much again for sharing your perspective and insight. Thanks again for coming back on the show.
Thank you, Kevin. Thank you for having me. Okay. Thank you.